everyone for coming. Welcome to Harbor Square. My name is Caitlin Saraceno. I'm with Upholdings. I'm going to be emceeing today's event, so thank you for bearing with me. So right now you are in our community hub space. This is where educational, employment, financial literacy, and wellness related services, events, and workshops will be made available to our Harbor Square residents, as well as members of the surrounding community. A few housekeeping items first. We have refreshments over in the back of the room. Bathrooms are located through this kitchen door right here. After today's event, we will be going outside for a ribbon cutting ceremony, followed by tours. We will break tours into 4 groups. If you have a name tag, you have a colored dot on your name tag. If you do not have a name tag, please just grab one for that purpose. The color will indicate what tour you will begin on. Okay. So I wanted to introduce our special guests and speakers. So first, a special welcome to our guests from the community and the project's finance partners. We have East Chicago's Mayor Anthony Copeland. We have the U.S. Congressman for the 1st Congressional District of Indiana, Frank Mervin's office. We have our partners at the East Chicago Housing Authority and IHCDA. And then we have our partners at FHLB Indianapolis, CREA, Fifth Third Bank, People's Bank. Those are our financial partners. And then we have our architect and construction team, Cordigan Clark, our partners at HealthLink, and our development and property management team at Upholdings. So to kick us off, please allow me to introduce Jessica Hoff-Burzak, co-owner and principal at Upholdings.
Thank you. Hello, everyone. It's so good to see you. I have not been in many public spaces in the past 18 months, so it's so great to see such an incredible turnout for this event. I think it speaks to the years that we've been investing with the city and with the state to make this possible. This project came with a really big goal. The state put out this statement that said, we're looking for qualified teams that want to work on affordable housing and also address transportation, social determinants of health, and maybe work on tackling generational poverty at the same time, which felt like such a big goal. Of course, the team at Upholding said, we can do that. And it's been a remarkable journey since then. I really commend the state for even asking that of housing developers. I think it's the future of this industry that we would be forced to have robust partnerships where we are doing so much more than just creating housing. At Upholdings, we believe that housing is a human right, but here we're going to do so much more than that. Our goal is to really take the existing, robust, incredible partners of East Chicago and find ways that we, as housing developers and managers, can help families access those services. So our goal is that we will help families raise their wages, raise their assets, and become more stable and independent in their communities, which is, of course, what we all want, right? We all want better jobs and better wages. And with some help and access to the resources of this amazing community, we really think that this could be a groundbreaking project with outcomes that will change the industry. And that's a big statement, but I really believe it. Our work at Upholdings has changed because of this project. We see housing in different ways. It's one of our smallest physical projects, but the goals that we've committed to here are big. And I want to thank the community partners for making it possible. I think that sometimes working in smaller cities is so impactful because, we worked with the mayor. We worked directly with the executive director of the community agencies to say, what do you do already? Oh, that's a great idea. How can we get that vocational service into this project, right? And so by being able to just have those incredible kind of one-on-one conversations in the early days, I think we've laid the foundation for a project that will really change the trajectory of affordable housing, certainly in the state, and I think really anywhere. So we're going to be implementing here what we're calling our Community Empowerment Roadmap. And so our idea is to really take those partnerships, and with our incredible management staff, trying to find her because she's doing the heart of the work here, and our community health workers in partnership with HealthLink, we're going to wrap all of those community-based services around households and help them improve their lives and live happier, more independent, stable lives, which is the American dream, right? So thank you to all of the partners for being here. We absolutely cannot do this alone, as you heard from the list that Kaylin described, but we're so honored that you invest in us and that you believe in our vision. Thankful to the incredible design and construction teams. I think you'll see as you tour, this is a really beautiful development. I mean, anybody would be proud to call this their home, as we saw by the amount of applications that we received. So thank you for your partnership. Thank you for being here today to celebrate what can happen when public-private partners come together and take big ideas and hammer at them until something realistic comes together. So thank you for being here. I hope I can meet all of you personally, and thank you for your support and partnership.
Thank you, Jessica. Okay, so next, please allow me to introduce Honorable Mayor Anthony Copeland of the City of East Chicago. Special thank you to the City of East Chicago for all of their support on this project, including the donation of the land that it sits on.
Wow. Didn't realize how many people was here. But let me tell you what Stevie Wonder said when he had his first kid. He said, "Isn't she wonderful? And isn't she beautiful?" We started off, I remember Jacob Sipes say, "We're going to make some gumbo because we're going to put a little bit of everything together. And when we get through, it's going to be good." You also have to admit, this is good. I can throw a rock. I can hit 35-29. That's where I grew up at. All my roots are in this area. And all I had on my mind was building something beautiful, building something great. It's about legacy. When we all work together, the next generation will experience our legacy. And that's what this is. This is a legacy project. It really is. Well, Councilwoman Orange, where's she at? Raise your hand. You know what I'm going to say. I was 7 out of 11. And so y'all know that's double luck. But I was raised to say anything I put my mind to, I could do. So when I set off across this whole city, when they gave me the city, it was $15 million in the hole. Now I can tell you we have a $70 million surplus, and we're going to build, baby, build, baby, build. But now I'm wrestling with the council because sometimes people can't see your vision. Sometimes your vision could be their nightmare. Huh? But I got 9 other people I got to make them see the light. Make them walk toward the light. Maybe with someone, I hope it'd be a train, but you know, can we all get along? But again, you know, we've made major investments in our parks. We've made major investments in all of our infrastructure, and we will continue to build until everybody in Northwest Indiana will see East Chicago is truly a city of hope and progress. So to each and every one of you, hear my heartbeat, thank you for coming. Love you.
Thank you so much, Mr. Mayor. Okay, our next speaker is Beth Robel, Chief Executive Officer of HealthLink. Welcome, Beth.
Thanks all, and it's such a privilege to be here today. You know, 8 years ago when we started here, I think I went and met with the mayor. It was a little rough in the beginning, buddy, but now we're best buds, right?
But what did I tell you?
You said, Beth, can I have what you gave us
Valparaiso.
Valparaiso.
I said, give me the same
And I
thing.
said, yes, Mayor, and he said, we did it. Now I think we're actually expanding on that. But I remember a drive you took me, and you shared your vision. And I hate to say it, I wasn't really sure that was really it, or whatever, but then I saw it. And I can remember being across the street for both the groundbreaking and the ribbon cutting. And I saw the Unity Center. And when we were invited to partner with Up Development, I said, yes, we're going to do it. You know, we've been through a lot. I feel like with the city. I remember the meeting where all the federal agencies got together about the lead issue.
Yes.
And Councilwoman Orange, I remember you saying, Beth, you need to help us, and I hope we've done that. This is another way to help the community and this city. You know, the mayor says, I love East Chicago, I love the mayor, and I love East Chicago. My husband's relatives, they were all around here in the city, and he was from here. So this is just being able to this is also our first time to be in a housing facility. So we're really excited about that. To be able to share our staff's core expertise, whether it's our medical, behavioral health, optometry, our community health workers working with social determinants. This is where we need to be in this city. I'd like to have a little, besides the mayor, thank you, and Up Development and Jessica and her team, we've also, had a great federal partnership as a federally qualified health center. Anything we do, even if the money doesn't come directly from the federal government, we have to ask. So we really appreciate, we want to make sure we're all legal about this. But both with Congressman Moran and also Senator Braun's staffing, and we'll hear from them in just a minute, we're really appreciative. We had great construction partners with Larson Danielson, and so we appreciate every time we've said, well, could you just tweak it a little bit? They've been great partners. And last but not least, I really want to thank the team at HealthLink. If you are a HealthLink team member, could you raise your hand? This is the staff that does it. They have to put up every day with my crazy ideas, my desire to do better in the communities we serve, and I will forever be thankful for everything you do every day. I know it's not easy having to deal with this crazy CEO, but I'm very appreciative. So with that, again, I thank everyone that's coming here. This is just the beginning. I can't wait to hear. I'm very outcome driven to hear the outcomes that we'll see. So with that, I would like to introduce Mark Lopez, representing Congressman Moran, say a couple words.
Thank you very much, Beth, for those wonderful remarks. Before I begin, my name is Mark Lopez. I serve as Congressman Frank Mervan's Chief of Staff. Joined here today with Senator Mike Braun's Regional Director, Tony Ferraro. I'd like to acknowledge his attendance and presence. As been referenced throughout the previous speakers, today we're here to celebrate more than just vision. We're here to celebrate the action behind that vision. We're here to celebrate more than partnerships. We're here to celebrate what that will accomplish in this building and on this footprint. As beautiful as this building is, as wonderful all the efforts that were undertaken to bring us here today, the true brilliance of this building is what it's going to mean to future generations. It's going to be life-changing and life-altering. But again, it was only made possible through a spirit of cooperation between state, local, and federal agencies in conjunction with the private sector. Please know Congressman Frank Mervan will continue to listen with listening with an ear and lend a helping hand wherever there are opportunities to highlight what the spirit of cooperation can accomplish and how it can be truly transformational for the people that are served in Indiana's 1st District. Thank you very much.
Tony, I didn't know, did you want to stand, where did he go? I know he was here. Do you want to stand up? Did you want to make any comments at all?
Instead of a normal Senate speech, I'll be brief.
I know. Can you do that, buddy?
Watch me. Thank you, Beth. My name is Tony Ferraro. I'm the Regional Director for United States Senator Mike Braun, and I will be brief. The enthusiasm in this room is infectious, and the mayor's comments were right on. I won't repeat anything, but the senator and through my office here covering the top 7 counties, we're really excited to see projects like this come to fruition with the public and private partnerships, with everyone working across the aisle to make a difference in the community. Thank you very much for having me. It's an exciting day, and I'm through.
Thank you so much. Okay, up next we have Jacob Sipe, Executive Director of the Indiana Housing and Community Development Board.
Wow, you're no kidding here. There's a lot of people here. Wow. On behalf of Lieutenant Governor Suzanne Crouch, who is the board chair of ICDA, just want to congratulate everyone who's been involved in the development. I want to share just a little bit with you about how we got here. Several years ago, I met with the mayor. We were tasked with a huge challenge in terms of developing affordable housing, some other challenges we had. But we could have approached it and said we're just going to focus on producing units. And we could have taken that approach. However, we didn't. As Jessica mentioned, we threw out a really, really big idea. And the idea was to integrate housing with our healthcare, housing with our infrastructure, housing with our energy, housing with our transportation, and housing with eliminating generational poverty. And you're thinking to yourself, wow, that's a lot. And you know what? When we looked at it, we said, that's just too much. That doesn't happen naturally, and it probably won't happen. But you know what I said? We have developers who do business in our state who are dedicated to this type of work. We have leadership and we have visions at the local level who are dedicated to taking on these challenges, like Mayor Copeland mentioned. We also have organizations that are financial institutions that are dedicated to ensuring that we can get the biggest impact for our investment when we do invest into housing. It is true, there is no financial package that will address all of those issues, unlike if you were to go buy a car. You just can't go in and say, hey, I want to submit an application to address all these things. It doesn't exist. And it took us a lot of time, and it took us a lot of, I know when first time I sat down with Mayor Copeland, he looked at me really strange and said, I'm not sure if I understand what in the world you're trying to do. I was like, Mayor, I think we can do this, but it's going to require all of us to come together. It's going to be a challenge. There are going to be some times we think we're not going to be able to do this. And I know there was a few times when Mayor Copeland and I sat down and we said, I don't know. I don't know if this is going to work. But we did have great leadership with upholdings and their dedication to understanding how we connect all these dots together. And I think we pulled it off. And then what you see here today is a tremendous amount of work, a tremendous amount of dedication and a vision and goals to try to get as close as we could to connecting all of these dots, and I think we've done a pretty good job with it. So with that, I do want to say congratulations. I want to point out one more group that hasn't been mentioned, and that is those that work in our trade industry. Yes. Their dedication to continue to work in the middle of a pandemic, to never stop, to ensure that we can be here today, is a testament to their dedication and their skill set and their work ethic that they have. Because without them, we would be delayed, and time is money, and it would have cost us a lot more money. But those guys and women who worked in the trades on this site, thank you and hats off to you for the work that you do and the skills that you have in the trade industry. So with that, I just want to say thank you to everyone and look forward to continuing this partnership. I know we have a great partnership with Mayor Copeland in the city of East Chicago. So look forward to more development as well. So thank you very much.
Okay, thank you. Next, we have Dan Moser from People's Bank.
and they saved the best for last. People's Bank has been proud to call East Chicago home since 1910. And if you haven't heard the story, we started in a bar. We did. One of our founders had a bar, and with all the people in the mill, he had a safe, and it was the only place to put your paycheck when you cashed it. So they brought their paycheck to his bar and put it in his safe. And from that, People's Bank started, and we're now $1.5 billion big.
Wow.
People's Bank has had a long-term commitment to safe and affordable housing in East Chicago. I've been here a really long time, okay? And the Cardinal Terrace project was the first new residential development in the city of East Chicago in over 40 years. And we did that 30 years ago. And that started the ball rolling. Okay, there has been a number of other developments since then. We've been involved in Health East Chicago. We've been involved in the Intergenerational Center and the Charter School. But the long-term commitment that we have had has been just a wonderful thing, and we are proud to call East Chicago home. Okay, we are proud to be a part of this. We are proud to work with the public-private partnership that made this work, and with the Federal Home Loan Bank, and bringing dollars in to make this happen. And as time has gone on, things have continued to improve and refine and address additional issues that are there. And this is just a great testament to the cooperation that can happen when people set their minds to do things. So thank you very much for having us here. We are thrilled to be a part of this, and we look forward to being a part of East Chicago for many years to come.
Okay, thank you so much to all of our speakers here today. I'm just going to go through the agenda from here. So in a moment, I'm going to direct you to the ribbon cutting ceremony. Following the ribbon cutting ceremony, we will be doing tours through both Harbor Square residential side and HealthLink's clinic side. You'll notice on your name tag you have one of 4 colored dots. If you don't have a name tag, there's still extra back there. You can grab one. So if you have a green or purple dot on your name tag, you will remain by the HealthLink clinic to start your portion of the tour there. If you have a red or blue dot, you will come back to our Harbor Square residential entrance to start your tour over here. Before the ribbon cutting ceremony, please feel free to grab any refreshments or drinks. Again, bathrooms are located through these doors on my right here, which I guess is your left. So from here, we'll head outside. We're going to go west towards Pulaski. That's the HealthLink Clinic entrance. That's where the ribbon cutting ceremony will take place. We're asking the speakers for today's event to kick off the pictures for the ribbon cutting ceremony. And while outside, if you're comfortable, you can remove your masks. But inside the clinic space, we do request that you wear a surgical mask. We have disposables available if you do not already have one on you. So, okay, so from here we'll head outside, again going west towards Pulaski to the HealthLink Clinic entrance for the ribbon cutting ceremony. Thank you.
Over here.
Steve Segura. Hi. Hey, there you go.
Okay, I'm ready when you are.
Give me ready first.
3, 2, 1. Woo! 5, 4, 3, 2, 1. Did I hear pictures? Now, picture Tiffin, one with my camera. Okay. All right, come on in. Huh? All right, I will. Picture right here.
Following you?
So through here is our checkout area. So after they're done with their visit, they would come here, make their follow-up appointment.
Okay.
This is just our back admin area, our workstations. Optical hasn't started just yet. We're hoping to have that in early September. But this wall will have the glasses display area. And this is just our office break room. When patients are coming in for an optical appointment.
I'm just looking.
Yeah, go ahead.
Being nosy. How you doing? I told him big nose.
How you doing?
I'm doing good. I'm doing good.
In this area, whenever patients are getting their optical screening, they would come in through here. We have 2 optical rooms. This is one of them. This is our intake office, so any outreach for different events or enrollment, if someone doesn't have insurance, we could help them there with Medicaid or Medicare enrollment. And this is one of our optical rooms. You could come in and see. We're pretty much set up, ready to roll. We're just finishing up some final touches, supplies, staff, medical starts. So this is our first medical exam room. We're prepared to see bariatric patients, higher furniture. We estimate that since it is senior housing, we have senior housing around us, we're equipped to serve that population. Through this hall, we have what we call telehealth.
Man, you got so many rooms.
Yeah, there's a total of 10 rooms. This includes our telehealth. So how telehealth works is we have a behavioral health counselor at the other clinics and other sites throughout HealthLink. If someone needs to come in and they're having some type of mental issues and they need to see a behavioral health counselor, we can connect them to a behavioral health counselor at another clinic within any HealthLink facility. So once patients are called to the back, we take their vitals. We're prepared to see patients that need wheelchair access, so this is our wheelchair accessible scale. And here we have the rest of the vitals that we take, or if we need an extra exam room, we double this room as that. Then down this hall, we have more exam rooms. You saw one of the other medical exam rooms. This is another sample of what it would look like.
Oh, it goes in the computer.
So it's almost like the S.
Oh, okay.
Yeah. And then right here to your right is our medical assistant nurses station. So we have our nurses, our medical assistants, they all work with the providers in conjunction here. This corner room is our procedure room or our lab. We collaborate with Quest Laboratories. So if a patient needs to get lab work done, and we can do it that same day here. Quest comes and picks up specimens at the end of each day for each provider. Yeah, so this hall just takes us to the end of the clinic. We have one last exam room. On the right is one of our offices for providers. And the really fun part about this is that through this hall, we can actually connect with the rest of the building.
Back around we went.
This is the break or the little kitchen area that we have. And then through here is right next community room where you presented. So we're all just really excited to be able to have this partnership. We're all excited for the community.
And like I say, we was there from the beginning. We did it to you.
That's right.